This episode is sponsored by the Body Image Upgrade, a 30-day course helping you rebuild your relationship with your body. Tools, resources, and daily exercises to upgrade your body image. Learn more at bodyimageupgrade.com and enter the code podcast for 50% off. Welcome to Breaking Body Biases, a podcast about creating health and happiness without worrying about your weight. I'm Christine DeFilippis, certified fitness professional, studio owner, and creator of FitProEd, an online education platform for group fitness instructors. Join me every week as I interview fellow fitness pros, dietitians, wellness practitioners, and a wealth of others who are sharing their journey and helping to destroy diet culture. Welcome to episode 22 of the Breaking Body Biases podcast. Christine here, your host, and I'm excited to be back interviewing someone. Today we have a registered dietitian on, and before we get into that episode, I just want to take a minute and mention a few exciting things that are happening. You know, this podcast, we started it only a few months ago, and it's truly been a labor of love, and I appreciate the emails and the comments and the reviews that we get, and connecting with other dietitians and fitness pros that are looking to destroy diet culture and just change the narrative around the topics that we discuss. But it's really cool that we were nominated for our very first award. So we were nominated for the People's Choice Podcast Awards, and I'm going to put that information not only on our Instagram, but on our website. So if you go to our website, you can give us a vote. It just takes a few clicks, and we are nominated in the health category. So head on over to either Instagram or our website, and I'll put the information in our show notes too. So our studio also was featured. I own Pop Fit Studio, a boutique fitness studio in the Philadelphia suburbs, and we were featured in the July issue. And it's their annual best of issue, and it recognizes like restaurants and retailers, and we were really excited to not only be nominated for the third year in a row. We've only been open for 3 years, but the award that we received was for best virtual classes. And it's not something, if you told me a couple years ago that we'd be winning this award, it wasn't the focus of our studio, obviously. But when COVID hit, we really innovated and looked for ways to take our virtual class game up to a higher level to really make it enjoyable for people to work out at home. And we put a lot of effort into it. So to be recognized for the best virtual classes, I am very excited about that. Now, for those of you that may not know, I also have a business called FitProEd, and it's where I've been training group fitness instructors and those who want to become group fitness instructors in various formats like dance, bar, and trampoline. And we're celebrating our 10-year anniversary this month. So a lot of really exciting things. At the very end of the month, my son turns 3, and it's going to kick off a fundraiser that we've been doing every year for Smile Train. My son was born with a cleft lip, and we give back. We are so grateful for the doctors at Children's Hospital of Philadelphia. They did an amazing job on my son's surgery, and we know that not everyone has access or the ability to have this surgery, this really life-changing surgery, and we're so grateful. So we host a Smile Train fundraiser every year, and we're excited because we have some really fun things. So stay tuned. Next week, I'll have some details on how you can help us fundraise as well. But today, let's get into our episode where I interview Liz Gural, who is a registered dietitian working in private practice, and she's dedicated her career to work with clients who have eating disorders, past, present, whether they've been undiagnosed or diagnosed. She works with those with eating disorders and clients who want to better their relationship with food and their body, and clients that want to learn how to eat intuitively and heal, really heal, what we talk about a lot on the show, heal from diet culture. She takes the principles of health at every size and intuitive eating into all of her sessions. And she's been working as a registered dietitian while also she struggled with her own undiagnosed eating disorder for a decade. So she really knows what it's like. She knows a lot on this topic. And we're going to talk a little bit about how she got the knowledge that she does, because it was not in school. She shares her journey about becoming a dietitian, the lack of eating disorder education that dietitians receive, and how many dietetic programs really perpetuate fat phobia. So let's get into today's episode. Welcome, Liz, to the podcast. I'm so excited to chat with you today.
Yeah, I'm excited to be here.
So you're a registered dietitian.
Yep.
So talk to me about how you got into this field. Is it something that you like, I always knew I wanted to grow up and be a dietitian, or were there things that happened that made you want to be a dietitian?
Yeah, so this is kind of a loaded question, right? So I actually became a dietitian out of my own disordered eating. I was definitely, I took pride in being like the healthy girl, quote unquote, when I was in high school and even before that. And it never really occurred to me that dietitians were even a thing. They just came to me. Someone mentioned like, "Oh, you can go to school for nutrition," while I was in the depths of my undiagnosed eating disorder at the time, and I was like, "That's what I'm going to do. That's what I'm going to do. That fits me perfectly. I can tell everyone how to eat quote unquote healthy. I already do that now unsolicited, so I might as well learn how to do it quote unquote the right way." And truthfully, as twisted as it sounds, I got into it almost as a way to learn how to further enmesh myself in my eating disorder, right? I wanted to kind of learn how to quote unquote lose weight the right way, even though I was already doing it in my depths of this eating disorder that I had for a while.
You thought you would get the answers and have the
Yes.
secrets that are out there.
Correct. Yeah. Yeah.
So you mentioned that you had an undiagnosed eating disorder. So how in your timeline did you diagnose yourself because you became a dietitian and learned about eating disorders, or
My first full-time job out of school was at an eating disorder treatment center. I knew nothing about eating disorders, and I know, we're going to kind of get to this a little bit later, but I didn't learn a ton about eating disorders in school. I had a very basic knowledge of it, like the classic anorexia client who is, severely underweight. That's kind of the extent of what we learned in school. So I never put the pieces together. It never clicked that I was in that population until I started working at a treatment center and I was counseling clients, and I was like, oh my God, I used to do all of these things. I still do some of these things. What's going on? Like, I had this revelation that, holy shit, I'm part of this population that I'm serving right now. And, at the time I was in therapy and through various different therapists and things like that, it's kind of just been established that I had an eating disorder. I don't necessarily know if I like diagnosed myself, but I certainly fit the criteria. I always say if I had gone to eating disorder treatment or if I had sought it out at the time, I absolutely would have been a candidate for that.
so rewind a second. I'm confused. You got a job at an eating disorder center based on your education going to school for nutrition, but you didn't learn anything about eating disorders.
Oh
So
yeah.
that's crazy to me.
Yes. Yeah. So after I graduated, obviously, every new grad is scrambling, trying to look for a full time job. And I just kind of took the first one that was offered my way. And I was so nervous, right? Because in school, we had maybe 2 lectures on it in 4 years. But I figured, you know what? I don't know a ton about this, and maybe this job will be a good opportunity for me to learn about it since I didn't have any prior education. The treatment center didn't really seem to have a super big issue with that. So they kind of took me in and taught me what I know. Well, the foundation of what I know.
So, like, how do you go about helping someone? Like, you're sitting there interviewing working one-on-one with people that are struggling, that are going to treatment for an eating disorder. And you're sitting there, you mentioned that a lot of the check boxes that you're like, oh wow, this is me, this is me, this is. So how are you coping with that? And then also like, how are you helping them? How can you possibly help them?
Yeah. Yeah. So fortunately, I do really well with like compartmentalizing myself from my clients, even then, like even when I didn't really know what I was doing. So in my brain, it kind of like shuts off my own triggers, and my own things that come up for me are kind of shut off. And it's like client mode. And I can still relate to my clients and I still empathize with them and things like that. But it didn't cross over that all that much. But yeah, I'm really, I pride myself on being good at talking to people and empathizing with people, and having compassion for people. And I think that that's really the foundation of how I was able to help my clients in the beginning, even though I didn't have a strong education in eating disorders. I didn't work through my own eating disorder shit yet. I wasn't as deep in my eating disorder by that time, so it was helpful that I wasn't like engaging in all of the extreme behaviors anymore. But there was definitely some ones that were lingering, that once I noticed that my clients who are in active treatment for that were doing them, I took a hard look at myself and was like, oh, okay, this is something to work on.
Wow. So we talked a little bit about the education that you have. So like if they're not teaching about, like obviously they're not teaching about health at every size,
No.
or not teaching about making you equipped to be able to work with people with eating disorders. What are you? How is it preparing you? Like what are they teaching you?
So my program that I was in was very heavily based in the clinical setting. So it really, really prepared us really well, honestly, to be a dietitian in a hospital where you see, you know, anything, right? Like you could see someone with diabetes, you could see someone with a GI issue, you could see someone on a tube feed who needs parental nutrition, all of these like slew of things. It was really focused on, again, my program, and from my understanding, a lot of programs. But yeah, it was really focused on the clinical aspect of things, and really heavily prepared us well for that, which, is some people's journey, just wasn't mine. Yeah. Yeah.
So now you're no longer working in the eating disorder clinic that you first were.
Correct.
Now you work more HAES aligned. So you obviously just had to learn that information on your own because
Right.
you didn't get that education. What made you shift? Was it you coming to terms with like your struggles, or like what was that shift there?
Yeah. So when I was working at the eating disorder treatment center, I actually had a supervisor that asked me if I had ever heard of Health at Every Size. And at this point, I was probably less than 6 months post degree, right? Like I had just graduated. And so, no, I hadn't heard of it. And she kind of introduced it to me and was like, this is really cool. This is really good information. And if you work in eating disorders, this is like a cool thing to know about. I did a lot of research myself into it because I thought it was really cool. I listened to a lot of podcasts. That's honestly how I got sort of my foundation in Health at Every Size and my foundational understanding of it. But yeah, it started with my supervisor in the eating disorder treatment center just having a one-on-one conversation with me, right? It was not treatment center wide that Health at Every Size was adopted. It was just a casual conversation. And like I said, I did a lot of my own digging and eventually saw how beneficial Health at Every Size is for the treatment of eating disorders and for humans in general, but specifically for eating disorders. And the treatment center that I worked at the time just wasn't it just wasn't in line with my personal values at that point anymore, and it wasn't in line with Health at Every Size, which I felt like was of the utmost importance. So that kind of led me to look elsewhere and to shift into what I do now, which is private practice with fully Health at Every Size coworkers and philosophies, and we can openly talk about it, and it's great.
So you mentioned that it was just the supervisor. So I'm assuming that most everyone else that was working at this eating disorder clinic was not HAES aligned, or maybe they were like you, that before talking to the supervisor, they didn't know anything about it. And you mentioned that, and I'm aware of this, that it's very beneficial for
Hmm.
to be HAES aligned, working with someone with an eating disorder. What happens to the people that are working with those that aren't HAES aligned? What do we want to hear these awful stories?
Yeah. So it's tough, right? Health at every size, number one, is, as we know, super beneficial. And for a lot of other people, it's super radical, right? And if a treatment center as a whole and the individual practitioners are not health at every size aligned, it shows, right? It absolutely shows. And the clients can sense that, and they can sense that people in larger bodies are treated differently, because ultimately that's how it, in my experience at least, that's how it showed through. And it wasn't super obvious, right? Like there was no, blatant bullying, again, in my experience, to people in larger bodies versus people in smaller bodies. However, the curriculum as a whole was more so catered to those with restrictive eating disorders and in smaller bodies. A lot of the representation was that of people in smaller bodies, which it just doesn't create an inclusive environment, and kind of subtly perpetuates that people in larger bodies are less than.
Yeah. So not many people talk about eating disorders. Like obviously you're getting treatment, you're talking about it to someone like you that works there, but it's often shameful. Like you just
Absolutely.
don't talk about it. So I love to get your opinion on the importance of like people, especially like you're a provider, you're someone that has struggled yourself and you are working with people. So do you share your story with your clients, or I mean you're obviously sharing it here. So
Right.
you're sharing it on a podcast and we need more people sharing their story. But I'm curious to know like how that in a like a clinical setting, how that works. Do you just listen and work with your clients, or do you think there's a need to share your story?
Yeah, so when I was in school, like I said, we didn't get a ton of eating disorder education. However, we were taught very briefly, right, about motivational interviewing. And in motivational interviewing, we're told never self disclose anything, pretty much. Don't tell
Mhm.
your clients about your life, keep it totally separate. And, me not knowing anything when I first started, I was like, okay, that's what I was taught to do. So that's what I'm going to do. And I kind of kept myself totally separate from my clients. And as I've, worked with this population for this long, I have noticed that a lot of my clients really value, number one, that they're talking to a human being on the other end of the screen now that everything's done virtually, right? Or on the other end of the couch, or, whatever setting. And in that, humanity is sharing that you've also been in the same place as someone else. And so I find that for a lot of my clients, it's helpful for me to at least let them know that, yes, I have struggled with an eating disorder in the past. Now, who gets more information and in what context is kind of individual, right? And it depends on the relevancy of the conversation. And of course, I never go into details about what specific symptoms I used and like a step by step of how to have my eating disorder, basically. I would, never go into detail to that extent. But I do find that a lot of my clients, like I said, really value and appreciate that they know that I can relate to what, even to a small extent, to what they're going through and what they're experiencing. And yeah, like you said, a lot of people just don't feel the same, I guess, and don't talk about it that openly, right? It's still seen really as like a taboo in a lot of ways, which is unfortunate, because I think that, you know, if you have a commonality with somebody, regardless of your role, regardless if you're a provider, if you're a client, if you're, a stranger on the street, if you have a commonality with someone, human beings want to feel like they have something in common with each other. And I really think that that has brought a positive element to a lot of my sessions with my clients, because they know, like, oh yeah, you know what I mean. And I really do.
Yeah. Yeah. And with all the shame attached to it, it's really hard to
Absolutely.
talk about it. I know recently I was watching one of the Real Housewives franchises. I'm not sure if anyone's fans, but one of the newest housewives came out and talked about much more in depth about her eating disorder. And several cast members then began sharing their story. And I feel like not many people talk about it publicly. Shame, shame just around it.
Mm-hmm.
And it's challenging because then there's, if you're in the midst of it, like you had the opportunity to be in that eating disorder clinic and hearing and seeing like, oh, this is me. But like how many other people kind of benefit from that? It's such a weird situation. Like it's not, you don't, I've heard even parents, a lot of moms not want to share their eating disorder with their
Mm-hmm.
daughter when they get to a certain age. So as someone that has struggled in this area yourself and that you work with individuals dealing with it, like what advice would you give to, people in general? I mean, obviously want to talk about it, but especially moms that are struggling with, when do I share this with, because maybe could prevent them having similar journeys. That's a common question I get from the moms that are, I don't want to share yet. I don't want to talk about it.
Yeah, I think that disclaimer, I don't have a child, right? So I don't know what it's like to be a mom, but I'm imagining that it's helpful to have those conversations early enough, right? When they can understand. Like I think that it's helpful to have these conversations while they're young and not young enough to not understand, right? But young enough to potentially know someone else that is struggling with similar things, right? So they are aware of it, and so it doesn't snowball out of control, right? Because a lot of times what I see, at least with my younger adolescents, right, is that, like we were talking about, this shame around food and around bodies comes up, and then they start secretly festering this eating disorder, and then it's only after they have, had dramatic changes in their body or the way that they eat that their parents notice, right? And if there was a conversation potentially before any of that was to happen, maybe that dialogue would have been there for that child to come to their parent and say, you know what, I also think that I feel weird around food, or I have negative body image or something like that. So like that dialogue is available for that potential eating disorder to not come about.
Yeah. Yeah. Because you work with the clients that you do, like you're seeing how it's affecting them. And although it is your job, so you don't want to not have clients, but wouldn't it be
Right.
great if you had no clients? Wouldn't it be
Absolutely.
great? You'd
Absolutely.
have to find a new line of work, but wouldn't that be a wonderful thing?
100%.
So, is there anything else that you'd like to share with listeners in the line of work that you do that you think might be helpful?
Yeah, so I think that one of the hills that I'll die on, right, is that eating disorders and disordered eating can look like any person on the street, right? There's not one specific body size, there's not one specific person that resembles what it is to have an eating disorder, which I think is a huge misconception, right? Like I said, even in my own college education, we got photos of what quote unquote an eating disorder looks like, and that was really it. And I'm a nutrition professional, and I think that I would love for more people to recognize that if you have negative body image and you feel some type of way around food that's not calm, cool, and collected, then it's worth looking a little bit deeper at, because there is at least some disordered eating there that deserves to be worked through. Even if someone is like, oh, well, I don't look like so and so, so that means I don't have an eating disorder. It's just not accurate. Even in my own journey, I was never quote unquote underweight, right? Which is why it was undiagnosed for 10 years. And I looked quote unquote fine. So everyone just, thought it was fine, including myself.
Yeah. I can
Yeah.
relate to that because I was told by one doctor, you're not
Oh,
that bad.
oh my God.
It
Oh
got
my
worse though.
God.
As you know, I kept going downhill. So it
Oh,
did
yeah.
get worse, but he could have helped me before it got worse.
Right. Right.
Just crazy. I so appreciate you sharing your story, and hopefully more people will share their stories, their journey. That's part of the purpose of this show, to make people feel so safe and welcome, and like just that it's empowering almost to
Yeah.
share and build this community. I'd love to ask you a few little quick fire questions we ask all
Yeah.
of our guests at the end. Nothing about eating disorders in this, just more about, we love to ask questions about people's favorite way to move their body.
Awesome. Yeah. I I have a Peloton. I'm one of those people that is like on team Peloton, if you will. I absolutely love it. I love, I'm going to shout out my favorite instructor, Cody Rigsby. If anyone has a Peloton that's listening to this, they know Cody Rigsby is amazing. And honestly, I've noticed that if you do have a Peloton and you are going to take a class, take Cody Rigsby, because he does talk about food sometimes in the context of like, I love to eat hot dogs. This 4th of July, you guys better go eat a hot dog. And, F what anyone else says, sort of thing, which I think is awesome and as you know, in like the fitness industry, to have someone advocating for you to eat what you want is amazing.
Yeah, because I can imagine some listeners are like, no, I'm not, there's going to be triggers on Peloton.
Uh-huh.
But to have this resource, we're going to put his name in the show notes. So if you want to try a
Yes.
Peloton class, thank you for sharing that, because we've done episodes before about not talking about food in classes, but again, in
Yes.
the way that it connects to earn and burn and that kind of stuff, because
Oh, yeah, yeah, yeah.
you can eat anything you want, regardless of how and when you move your
Absolutely.
body.
Absolutely.
So what's your favorite way to practice self-care?
Oh, that's a good one. I've been kind of experimenting with a couple different things. I am not a huge outdoorsy person, but I notice that when I do step foot outside, I feel different, right? Like I feel better. So I've been trying to take leisurely walks as a form of self care, very leisurely, like literally around my block. However, this heat the last couple of weeks
Yeah.
has kind of inhibited that. So I have also gotten a few new like face serums, and I've been doing a hefty skincare routine as a supplement to my health, to my self care.
Doesn't it feel so wonderful to
It
like
does.
just do that little routine on your face? You just feel like it's just moisturized, and just you
Yes.
just feel this certain kind of way that, yeah, I do. I've fallen off that habit. So you just encouraged me. I think I'm going to give myself a
Nice.
little home facial tonight.
Love that.
So what is something, we've all been locked down at some point. Where are
Mhm.
you located?
I live in South Jersey.
So you're not far from me at all. I'm in
Yeah.
Philly. So we've been locked down
Oh yeah.
for some time here. Restrictions have been lifted and we're kind of going back to our normal lives, but we might have experienced some time that we were home a lot and binging TV shows, or some people binge books. Everybody's got different preferences. So if there's something that you'd like to share that you found binge worthy.
So I don't know that it's something that I found per se. Um, More so something I rely on. And my favorite show is The Office, the most classic show, everyone's favorite show. That's definitely, I probably finished it twice during quarantine, start to finish. It's like old reliable.
Yeah.
I will say though, I've recently gotten Paramount Plus,
Oh, yeah.
and I started watching Why Women Kill, and I recommend.
Interesting.
It is. It's one of those shows that you kind of have to pay attention the whole time, so you really have to be in the right brain space to watch it. It's not like The Office where you can just turn it on in the background and go about your day. You have to pay attention so you don't miss anything good. But yeah, it's good.
And you learn why women kill?
Yes, these few women that it's a fictional show, I will say. But
Okay.
yes, we learn about, the ins and outs of their lives, and it's kind of like how do I describe it? It's like a murder mystery comedy.
Okay. I probably enjoy that more because it has the comedy in it. So if it's less
Yes.
real, I won't be as
Oh yeah.
traumatized by it.
Yes, correct.
And then we here at the studio I own, Pop Studio, we do a lot of workouts to music. So we love music here. So we always like to find music that inspires other people, whether it be music that you move to or just music you like listening to. Do you have a favorite artist, a favorite song, a favorite genre of music? What are you listening to right now?
Yeah, I have a pretty eclectic taste in music, I will say. I love One Direction is, a fan favorite of mine. Um I love Taylor Swift. Of course, I sound like, classic millennial, but um but right now my favorite song right now is Confetti by Little Mix featuring
Oh yeah.
Saweetie. Oh, I actually heard it on Cody Rigsby's Peloton ride the other day, and I saved it to my Spotify immediately, and it's been on repeat. It's so good.
Yeah, that is a great one to work out to. We use it in
Yes.
dance classes. So Little Mix never disappoints. But yeah,
They
that
really
remix
do
is
not.
good.
Yeah. Yes, it's so good.
Yeah. Well, it was so great connecting with you. And for those that want to connect further, I will put your information in the show notes, how to work with you, how to, just follow you if people want to get
Yeah.
more information and learn a little bit from like your Instagram. And we'll put all that information. And of course, I'm going to include Cody Rigsby's information
Yes.
in the show notes, as well as we like a good referral for a
Yes.
positive fitness pro, because
Yes.
there's a lot of work to be done in the fitness industry,
Absolutely.
just like there is in nutrition, as we learned in this episode. So
Absolutely.
it was great connecting. And again, I'll put your information in the show notes. And thank you so much for joining us.
Yeah, thank you so much for having me.
So that was my interview with Liz. If you enjoyed the episode, can you take a minute and give it a rating and review wherever you listen to podcasts? That helps more listeners connect with our show. I'll also put Liz's contact information in our show notes on our website. So check out that information to connect and learn more about the work that Liz does. Head over to breakingbodybiases.com. You can even ask her a question right on our website. Our mission is to amplify voices destroying diet culture to help more people live happier and healthier lives. Do you have a guest suggestion for us? Send them over to our website and apply to be a guest on an upcoming show. Thank you for tuning in, and we'll have a brand new episode for you next week.